You got the legs, but are they ready for short shorts in swimsuit season? Mine are not. Well, that's why we're going to talk to Dr. Bill Johnson of Innovations Medical. He's here to tell us about a whole range of effective options to reduce cellulite and improve the shape of your legs. Good morning.
Good morning.
How are you?
Just fine.
I am dreading this right now, but I appreciate this prop you brought. And this is our goal thermometer.
Our goal thermometer. Our goal is smooth thighs, okay?
Now, how does this work in showing us the hope to get the legs we want?
A lot of women have cellulite, but not every woman responds to every treatment, and they don't all respond the same. It's one of the reasons there's so many different treatments out there, and it can be really hard to figure out what's best for me. So we like to take a stepwise approach where we can help folks that get with increasing levels of invasiveness, increasing levels of intensity and time commitment. So we're going to start at the bottom and go to the top as we work through cellulite.
Okay, because not everybody is the same. Everybody's a little different. You might need a different approach. Where do we typically start with a patient down at the bottom?
Well, we really like to start with Legend or Thermage. These technologies use a type of energy called radio frequency, and they're really effective. Over 80% of patients respond, so most patients, this is where they can stop.
Oh, wow.
Now, Legend uses multiple treatments. We do have to come in 6 times, but I really like it on the back of the thighs. Thermage is only a single treatment, and there's nothing that compares with Thermage on the front of the thighs. It's really on the front, just the best treatment out there.
Good to know.
And so it works well on the back, but it's king on the front. So that's where we like to start, folks. It's a one-time commitment. There's no downtime. You come in the office, get it done. And Legend, if you have to come in 5 or 6 times, but you can come in, get it done, go right back to work, pick up the kids, whatever you need to do.
Oh, that's amazing. Because with me, I'm concerned about the back of my legs, so that's where I need to look. But what's the next step for those who want to look past radiant frequency?
Well, the next thing we like to do, so as we go up the thermometer here, the next thing we like to do is a technology called Smooth Shapes. And it uses a combination of laser energy, okay, it's a true laser, and some massage as well. And Smooth Shapes works about 70 to 80% of the time. And it's not a bad place to start, but I don't think it works in as many patients as Thermage and Legend do. That's why I kind of like to start with them.
Okay.
For those that need some more work done after they've done Thermage or Legend, it's a real nice place. Again, no downtime. You don't have to do anything. You can come in, get the treatment, go right back, and works very well.
Okay. And maybe our next step is AWT.
AWT, acoustic wave therapy.
Very nice.
Now,
what does that
acoustic wave therapy is a really interesting technique it's really a great technology for cellulite. It uses actually a miniature shock wave. It feels like a really intense massager, but it's actually a miniature shock wave similar to what we use to break up kidney stones.
Wow.
And it actually breaks up some of the collagen that's puckering and causing the skin to pull down. And it really is quite effective. It works 80 to 90% of the time. It's a little more to do than Thermage or than Legend. But we will occasionally start some patients with particular patterns at AWT because it's such a great technology.
Let's take this one step further. After AWT.
Well, after AWT, folks that really still have problems, really here at the top of our cellulite thermometer, we can use liposuction techniques like Smart Lipo, and we actually use the laser to help tighten the skin. Now, this can really do a lot, and it can help shape the thighs as well. Folks that do Thermage or Legend, they often see a little bit of improvement in thigh size. They may lose as much as an inch. But if you really need to address that, it's Smart Lipo. And then when we need to, we can actually do fat shifting. And this is an example where we actually shift the fat from one place into the divot. Those are more invasive. They do require a little bit of surgery, but you can make some really big difference in folks that have some really bad defects.
Okay. A lot of options here, a ton of options for wherever your legs may be. Obviously, the first thing you need to do is come and see you, and we can see where we need to go from there.
Give them advice.
Everybody, that information right now to call because summer is around the corner. It is now spring. You want to look good in those shorts. 214-420-7970 or 817-438-8319.